Hi, I'm Rebecca from New Dimensions Physical Therapy, and this is part 2 of the video that I did regarding how to climb stairs without knee pain. For most of you, if you tried that strategy, you probably feel a lot better. For those of you watching this, you may have still had some discomfort, and I want to explain to you why that is. Commonly, one of the most common reasons I see is that oftentimes this muscle that crosses the knee joint is difficult to recruit. So we're going to compare this knee to this one. This is the one that hurts her. So Jan, go ahead and straighten this knee and lift straight up to the ceiling. It's hard, she can definitely hold it on that side. Now straighten this knee and go straight up to the ceiling. And this one, it's hard for her to hold. She can't quite do that. And so when you can't recruit it, it's not that it's not strong. She's a very strong lady and she's worked very hard, actually for 5 years, to strengthen this knee. But sometimes the brain can't find a muscle. And that's when we say that the muscle is turned off or it can't be recruited. And the two most common reasons why this muscle isn't firing is often that there's a vertebra in the low back that's rotated, or often the sacrum is rotated. So what each person needs to be able to recruit a given muscle is completely unique to that individual. And I mentioned to you that it could be one of two possibilities that I commonly see, like the third lumbar vertebra can be rotated or the sacrum can be rotated. And in Jan's case, her third lumbar vertebra was rotated, but she also had some other reflex points and things I needed to hold. So if you think that this might be your issue, you could look for someone who specializes in clinical kinesiology, and that could be a physical therapist or a chiropractor, and they would possibly know how to turn that muscle back on. Sometimes dry needling can be helpful for that. And then once we got the muscle working again, so if you watch her, go ahead and straighten your leg and go straight up, Jan. I can push down really hard and she's really got it, the ability to hold it now. Straighten it again. The thing she couldn't do before is completely straighten her knee and lift it. So go ahead and lift. She lifts, I push down, and she can really hold that. Mm-hmm. And this knee is this muscle is really important for knee control going up and downstairs. And when it's turned off, you can do all the exercises and all the strengthening in the world, and you can't have it working. It's only working at 1% of its capacity. So it's functionally unable to really stabilize your knee when you're climbing stairs. Sometimes then after, when you get the muscle firing, there can be some residual soft tissue issues. Also, she had a lot of thickness in the bottom part of her quadricep muscle, right through here. Up in here is not so bad, but right close to the knee, right in here was a lot of thickness and tightness in this muscle. And that affects the ability of the muscle to be able to contract and relax. You're putting your knee over your first two toes, push off your back leg, push down through your front heel to use your glutes to come up to help your quads. There you go, each step. Yep. That's good.
It's actually easy to come up slow.
Good.
Otherwise I would have had to struggle before.
Yeah.
Okay. But when I go down, I have to do this.
Yes, and that's exactly right. Check out my first video for more details about how to climb stairs without pain. You can also check out my other video regarding how to descend stairs without knee pain. The techniques that we use in our clinic to get a muscle to fire when people can't recruit them are clinical or applied kinesiology and dry needling. You can check out the links below for more information. You can also find a physical therapist or chiropractor near you who use these techniques. Thank you for watching.